Good morning, my name is Sophie Cortez, practical nurse student. Today we'll do my lab skill assessment. First, I will do hand hygiene and I'm gonna start reading doctor's orders. Okay, I have patient Crash Oro, hospital ID 121-2393, date of birth 1960, February 20, male, allergies to morphine, primary diagnosis L2 compression fracture. Today's day, doctor ordered Ketorolac 30 milligrams every 6 hours intramuscular for 5 days, and then we'll reassess. So I will double check with my MAR now. The medication I have to give this patient at 12 o'clock. So I'm gonna do my first check. Patient's name, Crash Otto, male, hospital ID 121-2393, hospital ID 121-2393, date of birth 1960, February 20, date of birth 1960, February 20. Today's day, November 30, 2020. It is 12 o'clock and we have to administer Ketorolac 30 milligrams every 6 hours intramuscular for 5 days. I have doctor's orders, Ketorolac 30 milligrams every 6 hours intramuscular while awake for 5 days, and then we'll reassess. So my first check and my MAR match the doctor's orders. So I'm going to get ready to bring the supplies. Doctor ordered Ketorolac since our patient, Ketorolac is a medication for pain, and since our patient has allergies to morphine, this is a new medication to cope with his pain. Okay, I'm gonna bring my supplies. So I have here a syringe, expire date April 2023. It hasn't been opened yet, it's intact. I also have a needle, 23 gauge, April 2025, expired date, hasn't been opened yet, it's intact. Since intramuscular injections range needle between 18 to 27, I chose today 23 gauge. I also have a Blanfoil needle, this expired April 2023, hasn't been opened yet, it's intact. And my medication, this is a practice vial, don't have any information about my patient, but I have Ketorolac 30 milligrams per 1 ml, expired date April 2025, and this is a multiple vial, so I have 2 ml in this vial. So now that I have all my supplies with me, I will do a med before I withdraw some medication. So I'll double check with my MARs first. 30 milligrams every 6 hours. I have in the vial 30 milligrams Ketorolac. I have doctor's orders, Ketorolac 30 milligrams. So this is the right medication. Doctor ordered 30 milligrams and the vial 30 milligrams equals 1 ml. So today I will go and administer 1 ml intramuscular injection. Okay, I'll do one more time hygiene, and I'm gonna get ready with the medication. First I will clean the vial for 30 seconds. Those 6 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 29, 30. And I'm going to let it dry. I think we already said that reason that the doctor ordered this medication is for pain medication to cope since our patient has allergies to morphine. Okay, so first I'm gonna open. Most of my supplies has been already been open. I've been trying to practicing. That's why they have been open. Okay. So I have this one. I put this one here. Gonna put my Blanful needle. Okay, and I'm gonna withdraw some air since I'm only gonna need 1 ml. So that's where I'm gonna inject air into my needle. I can use my pen to help me get rid of the bubbles. Since this is a multiple vial, I'm gonna try to withdraw only the amount that I need. I have some bubble here, it doesn't wanna go. Okay, I have 1 ml without bubbles. But I will double check when I change needles before I do my label that I don't have any bubbles. I'm gonna do one more time. Looks like, I'm not quite sure if I have one little one there. Since we are gonna do a one hand scoop technique, I'm gonna pull my plunger down. So I'm gonna use the medication that I have in my in my Blanful needle to prime my other needle. Okay. Now I'm gonna change needles. We don't we throw in the sharpest container. So I'm gonna make sure I have the right amount and enough to prime my needle. going slowly. Just wanna make sure I have one without bubbles. I hope you can see. Now that I have my medication, the right amount, yeah, I got the right amount. Now I'm gonna make my label. So I'm gonna make my label. I'm gonna use my Mars for my label. So the patient name is Crash Otto. I'm gonna put his hospital ID number 121 2393. Okay, and today's date is November 30, 2020. It is 12 o'clock. The drug is ketorolac. And the dose is 30 milligrams equals 1 under 1 ml, and the route is going to be intramuscular. I'm gonna sign. So in my label I have patient's name, Crash Otto, today's day November 30, 2020, it is 12 o'clock. The name of the medication is ketorolac, 30 milligrams, 1 ml. This is an intramuscular route, and my initials and designation. Okay, now that I have my label done, I'm gonna put it on the cap, so I don't wanna cover the medication. Okay, I have my label done, so now I'm gonna do a check with my mark. So this is for Crash Otto, hospital ID 121-23-93, hospital ID 121-23-93, date of birth 1960, February 20. I don't have that information. Today's day is November 30, 2020. Today's day November 30, 2020. It is 12 o'clock. It is 12 o'clock. So this is ketorolac, 30 milligrams equals 1 ml, intramuscular route. I have in my vial ketorolac 30 milligrams equals 1 ml, and the expiry date we already said is April 2025, and my initials. So now that I have done my check, I'm not quite sure if I already done my second check. So this is my second check. I will do my third check before I go to the patient's room, before I leave the room where the med is. So I will do it one more time. This is Crash Auto, male, hospital ID 121-23-93, date of birth 1960, February 20. Today's date, November 30, 2020, it is 12 o'clock. So I have November 30, 2020, it is 12 o'clock. This is Kerolac, 30 milligrams, 1 ml, intramuscular. I have 30 milligrams ml Kerolac, 2 ml vial, so we draw 1 ml. Hasn't been given yet, so it is. I'm ready to go to the patient to administer this medication. I will leave this medication in the medication room, and I'll go to my patients with the MAR and this needle, the injection. Okay. Okay, so I'm going to the patient's room first. Hello. Hi, my name is Sophie Cortez. I am a practical nurse student. Can I come in? She says yes. So first I will do some hand hygiene, and I'm gonna close the carton to give you more privacy. So I'm gonna ask her to tell me his first and last name. So could you please tell me your first and last name? He says, I'm gonna double check with my mark and my label here. So he says Crash Auto. I have Crash Auto, Crash Auto. Could you please spell your date of birth? He says February 20, 1960. I have February 20, 1960. I'm gonna double check the hospital ID that I wrote in the label is 121-23-93, hospital ID 121-23-93. So I got the right patient. So first I will ask my patient how is he feeling, and he says he's feeling okay. I will assess for pain. Do you have any pain at this moment? He said yeah, he has pain. I'm gonna let him know that Kerolac is pain medication that we are administering every 6 hours for 5 days. When you are awake. He says okay. I also gonna check his vital signs before I administer the level of conscience. I will assess the skin of the patient, and I will assess for any lumps or tenderness on the skin where I'm gonna administer this. This medication is an intramuscular medication, so I'm gonna administer in the muscle. Is that okay with you? He says yes. Do you have any questions for me? And he says no. Okay, so I'm gonna grab some gloves. I'm gonna make sure the bed is in the working level position for me. Since I don't have any volunteers with me today, I print a picture of the site that I'm going to administer the medication. Okay, so I'll choose this site, the ventrogluteal site, for the patient. This is a large muscle, and that the medication will go in. So I'm gonna ask my patient to lie on the left side, and then I will do the landmarking on the right side. So first I will put my hand here. I'm gonna put the heel of my hand over the trochanter area. I don't know if you can see. And then my thumb is going to point it. Sorry, this is not my right hand. So this is that's why I was confused. I'm sorry. I'm gonna put the heel of my hand over the trochanter area, and my thumb I'm gonna point to the side, to the groin of my patients, and the middle index finger, and my index finger on the superior iliac spine, and then my middle finger extended along the iliac crest. And on this V shape, sorry, I don't know if you can see me, in the V shape that I'm making here, that's where I'm gonna administrate my injection. So when I'm gonna clean the site, I'm gonna leave the alcohol swab there, so remind me where should I administer the medication. So I'm gonna administer in the right side of my patient. So he's like this, okay? And this is the landmarking. Put it here. Okay. So I'm gonna clean when I'm gonna clean the site, I'm gonna assess the skin of my patient, so I don't see any redness or inflammations or hematomas. When I'm cleaning, I'm gonna clean for 30 seconds, and I'm gonna start from the center towards the outside, okay? And I also checking for any tenderness or abscess or lumps on the skin. Okay. So I'm going to do the C-track technique. So I will hold the skin taut to one side, and I will administer the injection 90-degree angle. Okay, I'm gonna get ready with my gas here. So I will, oh sorry, I don't know if you can see, on one side. But I'm gonna get ready. I'm gonna tell my patient he's gonna feel like a little burn, but I'm gonna be very gentle. So the C-track technique is to, on one side, and sorry, but this is very difficult on this part. And I'm going 90-degree angle, okay? So 1, 2, 3. And I'm going gentle, that means is like 10 seconds per 1 ml. I'm gonna leave it there for 10 more seconds to make sure the medication is there. I'm gonna remove gentle and put a little bit of pressure. I'm gonna discard in my sharpers container. Meanwhile, I'm gonna teach my patient that this medication is scheduled every 6 hours, so it's very important not to skip a dose. I know we are coming anyways to check on you. This medication might make you dizzy or drowsy. This is completely normal. and this medication might raise your blood pressure. So, but I will come back and in 30 minutes to evaluate and check if you have any signs of allergy reaction with this medication, and check your vitals and make sure you are safe. Okay, do you have any questions for me at this moment? And he says no, he don't have any questions. Before I leave the room, I will sign my mark. So it is 12 o'clock, it's Ketorolac, 30 milligrams every 6 hours, intramuscular. So I will sign my initials and designation. Okay. So make sure the bed is in the lower position when the bed rails are up. I'm gonna give you the cold bell. If you feel anything like you can breathe or you feel chills or anything, please call me. Will be but anyways, I will be back in 10 minutes to evaluate you. Okay. And anything else? Do you need anything else? And he says no, he's okay. Okay, thank you, and have a nice day. Okay, bye.